Hey everyone, it's Vic. Today, we're breaking down 7 doctor-prescribed meds that seniors should never skip. These aren't just about symptom control. They're about preventing life-threatening events and keeping you healthy for years to come. As we age, our bodies need extra support, and these medications are key. Skipping doses can undo all the protection they offer, leading to serious complications like heart attacks or strokes. Remember, this video is for education only. Always talk to your healthcare provider before making any changes. Ready to learn which meds are essential? Let's dive in. Here's the first one you can't afford to miss. First up, blood pressure medications, also known as antihypertensives. These are some of the most commonly prescribed drugs for older adults, and for good reason. High blood pressure is called the silent killer for a reason. You usually feel fine, but your arteries are under constant invisible strain. Over time, this pressure quietly damages your body, even if you don't notice any symptoms. This ongoing pressure can harm blood vessels in your brain and heart, making them more likely to clog or burst. That's why high blood pressure is a leading cause of strokes and heart attacks, especially as we age. Blood pressure medications work in different ways. Some relax your blood vessels, others help your body get rid of extra fluid, and some slow your heart rate. But they only work if you take them every day, as prescribed. Skipping doses lets your blood pressure spike back up, undoing all the protection you've built up. Even missing a few days can put you at risk for serious complications. Many people think, my blood pressure is normal now, so I can stop. But that's a mistake. The medication is what's keeping it normal. Stopping suddenly can be dangerous, and your numbers can rise quickly. Think of your medication as a daily insurance policy for your heart and brain. It's a simple step that pays off in long-term health and peace of mind. The benefits build up over time, even if you don't feel them right away. Staying on track with your meds is an investment in your future. Consistent use protects not just your heart and brain, but also your kidneys, your eyes, and your overall health. High blood pressure can damage these organs silently, so prevention is key. If you're on a beta blocker, ACE inhibitor, or diuretic, don't stop just because you feel okay. These medications are working behind the scenes, even when you don't notice. Skipping is like taking off your seatbelt because you haven't crashed yet. It just doesn't make sense. The protection is only there if you use it every day. For most people, this is a lifelong commitment. It's about building healthy habits that become part of your daily routine. Your doctor, your medications, and you are a team. Don't break the chain. Regular check-ins help make sure your treatment is working for you. Stay consistent, and you'll keep that silent killer at bay. Every dose counts toward a healthier, safer future. Remember, the goal is steady, controlled blood pressure for the long haul. That's how you protect your body from harm. Don't let a missed dose put your health at risk. If you forget, take it as soon as you remember, unless it's almost time for your next dose. If you have questions or side effects, talk to your doctor. Never stop on your own. There are often alternatives or adjustments that can help. Protect your future by sticking to your regimen. It's one of the most important things you can do for your long-term health. Your heart and brain will thank you for every day you stay on track. Let's move to the next essential medication. Next up, statins, the go-to drugs for lowering LDL, or bad cholesterol. These medications are among the most commonly prescribed in the world, especially for older adults and those at risk for heart disease. High LDL leads to plaque buildup in your arteries, narrowing them and raising your risk for heart attacks and strokes. Over time, this buildup can silently damage your blood vessels, making it harder for blood to flow freely. Statins lower your liver's cholesterol production, keeping your arteries clear. They also help stabilize existing plaque, making it less likely to rupture and cause a sudden blockage. Many worry about side effects, but for most, the benefits far outweigh the risks. Most people tolerate statins well, and serious side effects are rare. Statins are a long-term preventative therapy. You don't just take them for a few months and stop. They're designed to be part of your daily routine, just like brushing your teeth or eating breakfast. Stopping means your cholesterol climbs back up and the risk returns. That's why it's so important to stick with your prescribed plan, even if you're feeling fine. Diet and exercise matter, but often aren't enough. Statins provide that extra push. They work best when combined with healthy habits, creating a powerful defense against heart disease. High cholesterol has no symptoms. You won't know there's a problem until it's too late. That's why regular checkups and blood tests are so important. If you think you're having side effects, talk to your doctor. Don't quit cold turkey. Your healthcare team can help adjust your dose or try a different statin if needed. There are different statins and doses. Your doctor can help you find the right fit. It's all about personalizing your treatment for the best results. Consistent daily use is what keeps your arteries protected. Missing doses can reduce the effectiveness, so try to make it a habit. Think of your statin as a silent guardian for your heart, working behind the scenes to keep you healthy. Don't let your cholesterol sneak up on you. Stay proactive and informed about your heart health. Let's talk about the next must-have medication. Third on our list, diabetes medications like metformin or insulin. These drugs keep your blood sugar in check, preventing damage to your nerves, kidneys, eyes, and heart. Skipping doses causes wild swings in blood sugar, which can be dangerous and lead to long-term complications. Consistent use helps prevent blindness, kidney failure, nerve damage, and heart attacks. Even if your numbers improve with diet and exercise, don't stop your meds without your doctor's guidance. Managing diabetes is like flying a plane. Your meds are the controls that keep you steady. Medications like metformin may also protect your heart. For most, diabetes meds are a lifelong tool, not a temporary fix. Take them daily to avoid severe complications. If you want to make changes, always do it with your doctor's help. Your future self will thank you for staying on track. Let's move on to the next essential therapy. Here's what you need to know about thyroid medication. Number 4. Thyroid hormone replacement, usually levothyroxine for hypothyroidism. Your thyroid controls your metabolism. When it's underactive, everything slows down: energy, mood, even thinking. This medication replaces the hormone your body can't make, restoring your energy and focus. Consistency is key. Missing doses let symptoms creep back in, even if you don't notice right away. Take it daily, usually in the morning on an empty stomach for best results. Feeling better doesn't mean you're cured. The underlying condition is still there. For most, this is lifelong therapy. Don't stop just because you feel okay. Your body still needs that hormone. If you have questions or side effects, talk to your doctor. Treat your thyroid pill as essential as brushing your teeth. It's the key to keeping your body's engine running smoothly. Stay consistent for steady energy and health. Next up, a medication that protects you from dangerous clots. Number 5. Anticoagulants or blood thinners for conditions like atrial fibrillation. These meds don't thin your blood. They prevent dangerous clots that can cause strokes. Missing even one dose can leave you unprotected, raising your stroke risk immediately. The effect of these drugs wears off quickly, so timing is everything. Think of it as a 24/7 fire suppression system. Don't turn it off, even briefly. These meds also carry a bleeding risk, so take them exactly as prescribed. Never stop or adjust your dose without your doctor's input. If you're scheduled for surgery or dental work, make sure all your doctors know you're on an anticoagulant. For those with AFib or a history of clots, this is one of the most important meds you take. Consistency is your best protection against a life-changing stroke. Don't gamble with your health. Stick to your schedule. Let's talk about protecting your bones next. Number 6. Osteoporosis medications, like bisphosphonates, to keep your bones strong. Osteoporosis is silent until a fracture happens, which can be life-changing for seniors. These meds slow bone loss and help build new bone, reducing your risk of fractures. Dosing can be daily, weekly, or monthly. Missing a dose means missing all your protection for that period. Consistency is like making regular deposits in your bone bank. Skipping doses lets bone breakdown speed up again. The payoff isn't obvious day to day, but it's the fracture that never happens. If side effects are a problem, talk to your doctor. There are other options. Follow the instructions carefully for best results. Set reminders so you never miss a dose. This is a long-term investment in your independence and mobility. Protect your skeleton, and you protect your quality of life. Now let's cover a medication that's just as vital for your mind. Last but not least, antidepressants, especially SSRIs, are commonly prescribed for depression and anxiety in older adults. These medications can be a lifeline for those struggling with persistent sadness, worry, or a loss of interest in daily life. Antidepressants work by helping to restore balance to your brain chemistry, gradually lifting the fog of depression and anxiety. They can help you regain energy, motivation, and a sense of hope, making it easier to reconnect with loved ones and enjoy activities again. Remember, These aren't happy pills. They don't create artificial happiness. Instead, they work slowly over several weeks to help you feel more like yourself, restoring emotional balance and stability. Never stop antidepressants suddenly. Doing so can cause uncomfortable withdrawal symptoms and may trigger a relapse of depression or anxiety. Always follow your doctor's instructions closely. If you're considering stopping your medication, your doctor will help you taper off safely, minimizing risks and monitoring your progress. Many people feel better and think they can quit, but often, you're feeling better because the medication is working as intended. Stopping too soon can undo your progress. For some, antidepressants are a short-term solution, but for others, they may be a long-term or even lifelong treatment to maintain well-being. Consistent use is key to maintaining stability and preventing relapse. Setting reminders or using a pill organizer can help you stay on track. Treat your mental health medications with the same respect and care as any other prescription you take for your physical health. If you have questions or concerns, always talk to your doctor or pharmacist before making any changes to your medication routine. Your mental well-being is just as important as your physical health, and taking care of both helps you live life to the fullest. Take your medications as prescribed, and protect your quality of life by staying consistent and informed. Let's wrap up with some final advice. Always prioritize your mental health, and don't hesitate to seek support when you need it. That's it. 7 essential meds seniors shouldn't skip. The common thread? Consistency and communication with your healthcare team. If you have concerns or side effects, always talk to your doctor before making changes. Your health is a partnership. Don't go it alone. Thanks for watching. If you found this helpful, like, comment, and subscribe for more health tips. Stay safe, stay informed, and take care of yourself. See you in the next video.